Welcome to the Bestie Perspective, a raw, unfiltered space where we explore the mind, body, spirit connection. Every week, we dive into personal growth, holistic healing, and life's ups and downs to inspire, support, and remind you you're never alone on this journey. GLP-1 medications like Ozempic, Wegovy, Mounjaro, and Zepbound are everywhere right now. In fact, JP Morgan analysts speculate that 9% of Americans will be taking a GLP-1 medication by 2030. You've probably seen the headlines, the TikToks, and maybe even had conversations with your own friends or family about them. But behind all of the hype, real people with real stories are here. And that's what we're diving into today. Is GLP-1 a sustainable miracle drug or just another trend? Well, after speaking with these people, the truth is more nuanced. These medications can be life-changing, but they also come with challenges, side effects, and the need for real lifestyle changes. In this episode, you'll hear honest experiences from patients who've walked this path, what worked, what didn't, and the lessons they wish they knew from the start. And because we believe in blending modern medicine with holistic care, we'll also share insights on how to navigate this journey with support, balance, and compassion. So whether you're just curious about GLP-1s because someone you love is taking it, you're considering starting, or you're already on your own medication journey, this episode will hopefully give you the unfiltered truth to stay up to date on your medications, as well as practical advice and hopefully some reassurance that you're not alone. I had the pleasure of interviewing several people who have been on their own journey with GLP-1 medications, and those same people, as well as some friends and family, also helped me spread the word about this podcast by sharing a survey, which gave us even more insight into real experiences with these medications. On top of that, the three of us have been paying close attention to stories unfolding around us from friends, family members, and even former coworkers. And so today we're bringing it all together because whether or not you're personally taking a GLP-1, chances are you've either considered it or you know someone who's taking it. So before we dive in, I want to just take a moment and thank everyone who made this episode possible. Whether you joined me for an interview or submitted an anonymous survey, I am so grateful. Scientific data and research is important, of course, but I will never, ever overlook the power of personal stories and honest feedback from people we know and love. There will be two parts to this episode, and part one will be more of a conversation, story, and reflecting, and then in part two, we'll shift gears and dive into the most frequently asked questions about GLP-1s. So, all that said, here's a summary of some of the results from the interviews and surveys. These are, again, real voices, real experiences, and what they can teach us about the GLP-1 journey. So let's just start out with why most people chose to begin taking a GLP-1 medication in the first place. The motivation was a mix of health and hope, where some were facing type 2 diabetes, which is what the medication was originally approved for treating. Some were facing heart disease, sleep apnea, PCOS, or just stubborn weight that wouldn't budge despite exercise and dieting. Others simply wanted to feel better in their bodies and reclaim confidence. One person said, "I was the biggest I've ever been and the most miserable. My doctor offered gastric bypass surgery, but I wanted to try a less invasive option first." And I also remember that person telling me it would feel amazing to not have to use a seatbelt extender on the airplane for the first time in a really long time. Something that she was very self-conscious of.
Wow.
So just in reflecting on why people chose to start the medication in the first place, it seems like these people have a lot on the line and they're very concerned about their health and how they feel. So choosing to take this medication was a big deal for them. As far as wins and challenges go, many of the respondents lost significant weight, 20, 25, even 30 pounds. Some people lost 0 pounds. And it also depends on how long they were taking the medication too. One person described also feeling better than they had in years. And another one said, I never felt better. I love how I feel in my body. I have freedom from food, finally. Another person said, I can play with my grandchildren again because I have less joint pain. But it all hasn't been easy. The most common challenges were the side effects like nausea, constipation, and learning to balance nutrition with a decreased appetite. A few worried about long-term side effects or noticed their appetite returned right before the next dose. Some also noticed that their cravings or thoughts about food had not changed in the way that they had expected. And this is also one of the things that the drug claims to change because of the way it works in the brain. One person shared, restaurants and eating out with friends has been really hard. I've had to leave early sometimes because I've gotten so nauseous. One time I actually had to excuse myself to the restaurant bathroom to vomit. Another person shared, I know I probably shouldn't have quit cold turkey, but when I stopped taking the medicine, I was going through a hard time in life and I gained a lot of the weight back. And they also were kind enough to share advice for any newcomers or anyone struggling. One person said, release any shame you have about it being the easy way out, quote unquote. Start low and go slow with dosing. Be prepared to change your habits and lifestyle while you take it if you eventually want to stop, because the medicine helps you lose the weight, but it's up to you to keep it off. Another person said, do your research and ask your doctor questions before starting. Have a plan for nausea, protein intake, and lifestyle changes. Have a support system. And if you decide to stop, make sure you wean off. Don't do it cold turkey.
That's really interesting. It makes me think of those commercials. Like, I'm glad they're giving advice here and talking about the negative side effects, because any medication you've seen in a commercial that's talking about how wonderful it is, then you have that tiny disclaimer at the bottom, and you have may cause nausea, heart attack, death even, right?
Yes.
And it's like, but don't mind that.
Right.
Just talk to your provider. And it's very like, wait a minute, death? What? Hold on.
Yeah.
But look how happy they look in the video.
Right.
Their life has changed. I know, I get it.
Yeah, so I appreciate these people being willing to talk about the negative effects of it, because I do
Yeah.
think the promotions out there are highly positive, seeming anyway. And then another thing that stuck out was that people were expecting their cravings to change. I didn't realize that was a claim, that you will not crave food anymore. And people are saying, no, internally that has not changed within me. That was surprising.
Yes, that is actually one of the things that it claims to do in the body, is to reduce cravings, because it acts on appetite control centers in the brain. And I'll get into some other stuff later, but it does act on the brain. But it's so funny that for some people it doesn't affect that. Like, they'll still have the cravings, and there's a deeper conversation to be had there, because people's relationship with food is so complex. Like, just saying a craving is the only thing that caused you to have that is known to be untrue. There's so many emotional and stressor triggers. There's also environmental triggers and so many things that can influence what causes you to go reach for a food, even if it's not the quote unquote healthy thing to do.
Yeah. And I think it also begs the question of, if it's being advertised like that, are some people going for this option for that specific reason even?
Right.
Maybe even losing a larger amount of weight isn't even the number one concern for them, but maybe, again, like you're saying, the dynamic and complex relationships people have with food, and maybe the cravings in some people are just so strong, they're like, I'll try anything, even if it's this drug, and if I lose some weight, cool, it's a benefit. So it's interesting, the different claims around it. And of course, as we know, everybody's body's different, so things are going to react differently in everyone's body. And I'm sure it's been challenging for the people who came in wanting that specifically.
Yeah. And some people plan to continue, using it indefinitely, especially for those who have type 2 diabetes. If their A1C is improving or their weight is stable, they see that as a positive thing for their health because, in a sense, it's a preventative drug because it's preventing that damage from extra glucose running around in their blood vessels and damaging the blood vessels and their other organs. And for those people who were overweight or struggling with obesity, they also had cardiac risk factors at play as well, and using the drug to help prevent further issues with that. So, with that being said, every drug does have side effects. We know this for a fact. So, it's really about deciding for these people, what are the pros and cons of the medication, considering where they are at with their own chronic conditions and their health, and really deciding which route was the best way forward for them. And for some, that meant continuing on with the medication, even after meeting certain goals, just to ensure that they had the best chance at longevity and health compared to where they were at before. And others hope to eventually taper off and maintain progress through lifestyle shifts. And there was a lot of fear and honesty around long-term effects and whether or not it's sustainable to be on it for long term because of how the GI system side effects are so prevalent. But then there are people who have zero side effects and they say they have a great experience with the drug. So it feels very mixed and individualized. So it's hard to say like a bigger picture. Looking at these survey results is a very small survey, guys. Like we're talking like 10 people between surveys and interviews. So
Yes, for anyone that's ever had to take statistics, that population size is not a good
yeah.
one.
So yeah, it's difficult to advise people listening. Like this is a very small, a very small population.
Sure.
Not making for very strong research, but just rather a conversation opener was the goal with this.
Yeah.
And to hear from real people.
Well, it almost makes you think that maybe people should try it, but really pay attention. It seems like it could be hit or miss. It seems like it's very dependent on your body. It's, as you said, individualized to where if you're getting a mix of results for yourself, it's okay to just own that it might not be for you.
Yeah. And there's different versions of the drug too.
That's fair.
Some work better for others in terms of side effects. And I know Lauren even got an ad for one and they were saying, did you know that there's an even stronger GLP-1? And kind of just saying like, forget about the side effects. Like if you want to lose even more weight, like try this one. When for some people, that's shouldn't always be the goal, but rather like which one works for you the best and like looking at the bigger picture, not just so honed in on like be your smallest self. Cause I don't know, it doesn't help people see themselves in a healthier light. Like that's saying to me, be your smallest self. That's the only time you're acceptable. It's like when you're trying to be your smallest.
Mm-hmm. Yeah. And that specific advertisement, I feel like there's already so much out there. We know Ozempic is known to make people lose weight. And so for this to come on and be like, forget Ozempic, lose more, just the way that it felt was, oh my gosh. So they're saying, if this isn't good enough, if this isn't making you lose enough weight, go to this one, where I feel like it already seems to make most people lose a good amount of weight. So it's kind of wild. Like you're saying, Hannah, it's like really putting that emphasis on smallest self. Like you thought you got small with this one. Well, why don't you try this one and see how small you can get?
Yeah, but there's a reason why they're advertising it, because when I was doing market research, one of the most paid per click questions on the internet is which GLP-1 is best for weight loss? Like which one will you lose the most weight with, essentially, is like what they're trying to find out. If I remember correctly, that was the highest paid per click question out of anything GLP-1 related on YouTube, Google, TikTok, everything. So
Wow.
like it does not surprise me that that was an ad.
Yeah. Dang.
But as far as the bigger picture goes, it seems like almost everyone agreed that GLP-1s are changing the conversation around health and weight, and that it has the potential to help prevent or reverse chronic diseases. A lot of them emphasize that the injection is not a magic fix, but that they do make lasting change feel more possible, because a lot of them are able to embody more of the lifestyle that they envision will help them lose weight because they have more control over their cravings, even if they're not completely gone. They're having to be more mindful about when they eat food. Like I had one person tell me in an interview, I can't wait until I'm starving to eat because then I will overeat and I pay for it. I have the worst stomach pain I've ever had. I'll get nauseous.
Oh, wow.
So they have to be very mindful about like, okay, eat small meals, lots of protein throughout the day, and which can be a helpful eating habit even without that medication, is what I'm trying to get at as far as like lifestyle change and stuff, because we tend to make poor diet decisions when we're like starving and desperate for food. We pull on the things that are easy and quick, not always the healthiest. As far as support systems go, we're almost done here with the survey reviews, but as far as support systems go, interestingly, a lot of people weren't offered a lot of support from their prescribers in terms of like guidance or coaching. It was really common for doctors to be monitoring bone density, muscle mass, and that sort of thing. But as far as like lifestyle change, support, most times it was just a handout with a QR code for recipes, or being told, hey, the drug manufacturer offers free coaching support and other like blog resources, recipes, and things. But a lot of them were not using it. I don't think I had one person say they used it.
Honestly, that doesn't surprise me. I feel like with a lot of medications, doctors are like, here, take this and we'll see you later. Let me know how it feels. And that's it. And so it's unfortunate that it's just kind of like, this is one that's just going to be added to the list. People are already
Yeah.
experiencing that. So it's unfortunate.
And I think what's sad is we know most people aren't likely to go and do the extra work, as far as they could say, oh yeah, well, we gave them this QR code or this handout or these quote resources, but I don't feel like it's actually providing the support people truly need. I feel like a lot of people need it splayed out in front of them.
Yeah, a conversation.
And need it to be,
Mm-hmm.
yeah.
Yeah.
Not just, here's some papers, here are the drugs, good luck.
No, it reminds me of our episode on hospital versus holistic, the pamphlet wall.
Oh, yeah.
Yes. Oh my gosh, yeah.
You'll need, here, take home this pamphlet and this one and this one, and see you next time.
And the other thing I think about too is us all being nurses, for example, we had to learn how to do proper scientific research online to find credible sources and such.
Yes.
That was literally part of what we had to do in nursing school.
Right.
Yes.
And most people, I would say, didn't have that training. And so, again, when they're talking about Dr. Google or WebMD, right, or they're just Googling these things. And so I feel like even without the doctors giving them a proper, here's what to expect, or come see me if XYZ happens, because that's not normal, I feel like they're not even getting that time of day. And so then when people are experiencing things, they're maybe searching things
in a general way.
In a general way, right? Where who knows what results they're getting or even where they're being steered to on the internet.
Right. Yeah.
And it's just adding to that, I feel.
Well, it's not even, it's a good point that we had that training and we know what to look for, but we had access because we were in the university and whatnot. Some of these hubs for scholarly articles aren't accessible to everybody. So that makes it even
Yeah.
worse. They're not
Mhm.
even going to
Or
find.
you have to pay.
Exactly. Yeah. Not free access.
Or I've found even like the more scholarly ones that I'm able to find are so in science speak that anybody,
Mm-hmm.
the just general regular person would be so
Like,
confused.
What?
Yeah.
Okay.
Yes.
Yes.
Exactly. So
And I actually, I'm glad you brought this up too, because I was doing some research in creating this episode on some topics we'll talk about later. And a tip I have for anybody out there who does not have a medical background, utilize AI to help you break down those complex words, or utilize your family nurse or doctor.
Right.
And say, or like, as in like your daughter or sister, aunt, or whoever, and say, hey, can you help me explain this? And one part of scientific research that is particularly helpful to look over besides the abstract is kind of like the summary that you see at the top. A lot of times at the bottom in the section called the discussion, they will discuss the downfalls and where their research comes short. And it's a red flag if they do not discuss that, because almost every research does have some sort of shortcoming or things that you should take into account to not put it on a high pedestal and be like, this research came out, this is the law, this is everything. You know what I'm saying? Those are two or like a few great places to start if you are not medical. I also don't want to like demonize doctors. I know not every doctor is in and out, don't give you the time of day. Some do listen, which is amazing. I wish every doctor made time to be with their patients like that. And it seemed like in talking and getting the surveys from these people, a lot of them filled that gap with getting support from friends, coworkers, other online communities, or anywhere where they felt safe to talk about and share experiences and tips back and forth from other real people, rather than having another person tell them what to do and what should be normal or not normal. They were relying on each other and kind of going through it together. So I thought that was a beautiful way to fill the gap.
Yeah.
Yeah.
As far as what had changed is confidence being a huge theme. A lot of people felt better in their bodies, had less pain, being more active, like with grandchildren, for example, and just really proud of the progress that they were making, because a lot of these people had tried other things that did not work for them, and they were finally seeing the progress that they were lacking. So confidence, yes, was a huge theme. And a lot of them shared their relationship with food had shifted because they had less of an appetite. They were having to focus more on the quality of foods that they were getting to prevent muscle loss. They were focusing on protein. And even people saying that they had lost interest in alcohol because that was also a trigger to some of the bad side effects. All in all, though, I think one of the biggest takeaways was people really claiming that they needed a lifestyle change. And that was the foundation of their results. Because when they stopped working out or eating well, they noticed how quickly old habits and mindsets returned, even while on the medication. So I hope hearing a summary of these people's real experience on the medication either opens up your eyes if this is something you're considering doing and helps you make up your mind. And if you're on the medication, hopefully it makes you feel less alone. Like, hey, that reminds me of me. There are other people out there having experiences just like you. We also wanted to do our part in making sure that we share both sides of the story, both negative stories we've seen and positive, because we want you to make empowered and educated decisions. And if you're on the medication, you should always be up to date on like the latest stories, news, and anything else that you might be missing out of if you just checked out once you started the medication, which no shame there. That is so common. Almost every person I know who starts taking a medication does that. So this is just in an effort to fill that gap. Lauren shared with me a story of one of her old coworkers. She sent me a video that really shocked me and blew my mind. And us talking about it and coming up with this episode, it was one of the first topics of our conversation. And we were all like, whoa, more people need to know about that. I didn't know that was happening with this medication. I can't remember all of the details though, Lauren, if you'll share more.
Yeah, sure. So this person was a coworker of mine, and an old coworker, I should say, of mine, and she had a really intense experience with Ozempic. During COVID, she was diagnosed with type 2 diabetes and was prescribed the drug. And at first, she said it felt like a miracle. She compared it to the medication version of gastric bypass. She lost weight, she felt good, and she thought she finally found the solution with this. But after a while, the side effects started showing up for her. And she really did lose a significant amount of weight for her height as well at this point. But then she started developing gastroparesis, which, for those who don't know, it basically means your stomach muscles slow down so much that food doesn't move through properly. And that led her to experience terrible nausea, bloating, cramping, even what's called sulfur burps, where you'd burp and just have this awful smell and taste. And she even started throwing up out of nowhere all the time, to where she was feeling the concern of others with how often it was happening. It ended up getting so bad that she had to stop taking the drug. And she also noticed she lost a lot of her muscle while she was on it. And that when she stopped, she not only regained all the weight she lost, but she gained even more back, ending up heavier than she was when she first started. But what really struck me was how she said Ozempic felt like a Band-Aid, not a long-term solution. For her, it came with really serious health risks. And she wanted to speak out because she doesn't want others to go through the same thing without knowing what could happen. And she even warned that gastroparesis can sometimes become permanent in people, leading to things as severe as needing a colostomy bag for the rest of your life. So thankfully, her symptoms went away when she did stop the drug. And her takeaway was that for anyone considering Ozempic just for weight loss, to do your research, to talk to specialists, and know that it's not necessarily a safe or sustainable option. In her words, it felt great at first, but in the long run, it was a terrible drug for her body. So that was her specific experience with it.
This is not meant to instill fear in anybody, but I feel like it's just so important to stay up to date on other people's real experiences with the medication and just know the risks so that it helps you be more aware of your body and your experience with the drug, especially if you're already taking it.
Yeah, for sure.
One of the stories that I heard was actually in a Facebook comment from someone. The original poster was a new mom, and she was having difficult time losing the weight. I think she was still breastfeeding. So, she's not, it sounded like she was still within the first year of postpartum. And so she was asking for people's real experiences with it. And one of the comments was just super blatantly honest and instilled fear in me, even saying taking Ozempic nearly killed me. There's a difference between compounded semaglutide and Ozempic. Compounded semaglutide killed my cousin, and I've taken both compounded and the name brand, and I was seriously ill on the compounded, vomiting daily and having severe stomach pain. So when my cousin died from severe gastroparesis, I consulted my doctor, who warned me that the lower price tag isn't worth the risk. I know a lot of people who have had success with the compounded, but just wanted to share my own experience as a warning.
That's so scary.
Yeah. And there was people in the same, a lot of people outnumbering her, saying that they had great experiences with no side effects, they felt great, been on it for over a year, no problems. And so reading stuff like that just really opened my mind. I was like, wow, there's so many people that have good experiences, but the ones that are bad are really bad.
Right.
It doesn't really seem like where's the in between here?
Well,
Yeah.
both of your examples are scary. And I mean, just the gastroparesis alone is enough, but for it to cause someone to lose their life, that's pretty intense.
Yes.
Yeah.
And as more people are using the drug, they are updating their side effects list and like contraindication list. Like if you have history of medullary thyroid cancer, that is a contraindication to using the drug because there have been people who have been developing thyroid tumors. I didn't really believe this at first. I was like, no way, people are like potentially getting cancer from this. And I kid you not, the next day, one of the people I interviewed said, oh, my coworker's friend, she was having trouble swallowing and she thought the medication was making her gag since nausea is a side effect. Then her throat also started feeling scratchy and she thought maybe she was just getting sick and, you know, how it is when you have like mucus and post-nasal drip at night, you get like a scratchy throat. As it turns out, one surgery later, out came a golf ball-sized tumor that had developed on her thyroid.
Wow.
Oh my gosh.
It was benign, but still, she had no history of thyroid problems before.
The only thing that she
Oh
did
my
different was the
gosh.
medication.
Is what it sounds like. And mind you, I'm hearing this third hand.
Sure.
So
Fair.
Well, I also heard from the coworker that I shared her story. One of her friends commented on the video saying that someone they knew had to get their gallbladder removed after
Mhm.
taking it. And
Yeah.
so
In the
yeah.
FAQs, I do cover all of the side effects. So if you want to stay tuned and get an updated list of the side effects, definitely pay attention to that. That's in part 2 of the episode. I also heard third hand that her doctor still has her on the medication. And so I don't know if this episode would ever make it to her.
Oh boy.
But as your friend, I would definitely open up a conversation with your doctor and ask question, get curious about why you are still on the medication, if you know there's thyroid contraindications.
And even just thinking though, because we don't fully know the extent, right? They keep coming out with even more side effects or contraindications for this medication. And it makes you think, if you were the person that ended up getting this benign golf ball sized tumor on your thyroid, who knows where else it could cause tumor growth if it's stimulating cell growth in that way in her body. You know, and like you said, for
That's
her
a
to
good
stay
question.
on it,
Like it's a known thing to be looking at the thyroid, but you're right. If it's happening there's a possibility it could happen elsewhere.
especially if it had that effect on her body with no other history of thyroid issue.
To focus on the positive, there are some really positive stories out there. On that same Facebook thread I was reading, where the recently postpartum woman was asking for experiences about GLP-1s, there was a few people that shared really inspiring posts. One person said, I gained an insane amount of weight with twin pregnancy where my body couldn't support my weight. I was very small, but after pregnancy, I couldn't get back to normal, and I was in so much physical pain. I met with my doctor and qualified since I was considered obese, and it was the best decision ever. I lost close to 50 pounds within a couple months. That's kind of a lot for 2 months, guys.
That is a lot.
That's
I was just
fast.
thinking,
Like on
I
a
was like,
side
dang.
note.
Whoa.
But she said, I can play with the kids and run around, which I wasn't able to do because of my severe knee pain with all the extra weight. It's been a year. I'm still on it. I got my life back.
Wow.
One person said, I freaking love it. I'm so sorry for those who have had a bad experience. I chose compounded tirzepatide and have done a low dose since December. It's been incredible feeling like myself again, and for me, it's been so worth it. I'm making sure I take my vitamins, get my steps, and focusing on eating quality foods.
That's good.
If anything, I think hearing those stories that are scary are really opening up people's minds and saying, okay, like shit, I really need to make sure I'm on top of my health and getting my labs monitored and making sure I'm getting check-ins while I'm on this medication.
Right.
And even if that's not your doctor's protocol, it's certainly going to open up some questions and conversations of like, hey, is this possible? I'd feel a lot better about my health if we could do this.
Yeah.
Don't forget, just because you're not a doctor, you're not a nurse, you're still allowed to advocate for yourself as a patient and what you think is best for you.
Exactly.
Definitely.
One other positive story I wanted to share was this person responded to that same thread saying, I knew I needed something to help change my diet, and my results have been life-changing for me. The practice I went to has a team that really works with you to create better lifestyle habits to sustain your results post-treatment. They titrate your dose in a way to mitigate symptoms, and their price is the same each month no matter your dose. They also monitor your bone density and muscle mass, and I've been able to maintain my goal weight off of the medication, and I was able to maintain my muscle mass completely through weight training.
Wow. So this even just makes you think, do your research for where you're going to get the treatment.
Yeah, like what type of support do you need?
Right.
Knowing yourself, what support do you need so you can interview these places and like do consultations about what they provide.
Right. Because it's easy to get pretty much anywhere now, any of these GLP-1 drugs. But this last story you shared really is an experience. You know, this person found a place to give her a really good experience and set her up for success and mitigate a lot of those symptoms that people are seeing. The muscle loss, the rebound weight after, the symptoms, right? Because you mentioned that they titrated the dose so to try to mitigate the symptoms you feel. It really sounds like she found somewhere that really put the human experience over just passing out a drug. So that's incredible to hear.
But no, I was also going to say it sounded like it was more of a holistic approach, or at least involving that in the sense of let's create lifestyle habits. Let's make sure we're maintaining your muscle mass. Let's do weight training. It sounds like more well-rounded versus here's this medication. We'll check your weight loss and we'll stick with just that. No, I don't think that's the way to go, especially with the scarier stories now that we've heard both sides. Yeah. I think approach with a team that's going to help and navigate with you. That sounds like a very reasonable route to take.
Yeah. I don't know if my memory is serving me correctly, but there was at least 2, maybe 3 people who were advocating for that clinic, and I want to say one person said they offer like health coaching. I'm not sure, but it did seem like a very well-rounded approach, which I appreciated.
Yeah.
Very, very much.
Yeah, for sure.
So kind of off the topic of positive and negative stories, even another layer deeper to this, the original Facebook thread was a mom who was freshly postpartum. And so it sparked the question in me of what about body image and GLP-1, and what about diet culture and eating disorders and all of that in GLP-1? Because in the headlines, I see like the side effects and the lawsuits and the scary things, but I don't see many people talking about, hey, like, what about this? Like, this is a huge aspect of your journey for a lot of people, especially women.
Yeah.
My heart went out to the mama. I was like, girl, give yourself time. Your body literally created another life.
That's where I definitely can chime in with that, because I did end up successfully losing all the weight after my pregnancy, but it did take time. And there's a really unrealistic expectation of like 4 weeks, you're good, let's go, get it moving. And that's just not accurate. But it's literally, I think it's something like the average time for the wounds to heal is 6 months. And then for your hormones and everything to rebalance, it's years. I think physically everything is like a year, but hormonally can even be years, multiple. So it's just like, y'all.
Wow.
A lot of women are actually told if you're breastfeeding, do not worry about losing weight right now. It shouldn't even be a focus. So there's so much that comes to play with weight and postpartum, that whole fourth trimester that, yeah, I think that if women were talked about it more, then they could give themselves grace and not think, oh man, maybe I should consider a GLP-1 when it's like, oh gosh, let's talk more about this after having a kid time frame that we just don't really discuss enough, in my opinion.
We're not all Kardashians.
Right. Will they be rich too and have access to a lot of help too? Ain't fair.
Right.
Or Serena Williams.
Right.
Yeah. But it's like, that's what I think we're seeing.
Yeah.
And that's being pumped out there. And we're not actually, like you said, having that conversation as real women with our real experiences.
Yes, exactly.
Yes. One of these companies who is well known and well marketed, they spend plenty of money in marketing. They have a new celebrity ambassador, Serena Williams.
I have seen this commercial. Yes.
Mhm.
Yes. So, and they market that. The story is, hey, she's a gold medalist athlete and she had a hard time bouncing back after she had kids to where she wanted to be. And she has all this willpower. It was when she turned to GLP-1 that she was able to get the results she wanted. So I feel like in that sense, it's probably reaching a lot of these postpartum women and gets them thinking, oh, like we're supposed to bounce back. So like if I just use this, you know, I don't even know what timelines Serena Williams we're talking about. I don't know how far postpartum
Right. That's true.
she was when she started. They don't talk about that in the ad. So yeah, just thought points. And so, like I was saying, this is where I started to do my research, and it came up in my interviews also. Body image and eating disorders. They are really vulnerable topics, but honestly, they are too important to not talk about when it comes to GLP-1s. And I know a nurse practitioner who is also a board certified nurse coach, and she helps prescribe her patients GLP-1s. She shared with me that one of her intake questions is, do you have an eating disorder or do you have a history of an eating disorder? Which it should be asked by all practitioners prescribing this. So I was looking for research on this, and there's not much out there yet regarding body image. In fact, I found the very first study that was released this year that even looks at body image in GLP-1. So it's not very strong, like gold standard evidence, but it's more like an early conversation starter. It was a survey that was done among young women on a college campus. What it showed was that people with higher BMIs, more body shame, more weight concerns, and more self-objectification were more interested in trying GLP-1s. And they were also more willing to put up with the side effects, which we all know is like not comfortable stuff.
Right.
Yeah.
And on the flip side, people who had more appreciation for their bodies, like a healthier or more neutral or positive relationship with themselves, seemed to be more protected, and they were less likely to turn to these meds out of shame or dissatisfaction, and like would not be willing to put up with those type of side effects.
Interesting.
So basically, right, it was very interesting.
That mindset played a role.
Yeah, that opens up another door of conversation when you're thinking about, okay, is this the right option for me? Also consider, what is your body image and like your relationship with yourself when you look in the mirror? What is that like?
Yeah.
Because the scariest thing is if you lose weight and that relationship outside, if that physical outside has changed, but the upstairs here in the head, if that hasn't changed.
I think a lot of people forget that your body is a manifestation. We don't include that often, but whatever you're dealing with your body is a physical manifestation here. And so whatever identity you might be attached to, it makes sense that you might be the identity of someone who needs a medication, but you're also tied to the identity of an overweight person, to where it makes sense where people that get off the medication gain the weight right back. It's often been even in other weight loss journeys where you'll see people gain the weight right back because they're often tied to an identity of having the weight. Could be other emotional things as well. There could be trauma and other things as to why you're attached to holding on to that. But it does make sense that you gotta change the inside and the outside will reflect. And that this study is kind of proving that. That's pretty cool, I will say. I hope that people take this as an empowering message of, wow, so I can really change my appreciation towards my body and see some differences. And maybe people hear this and don't believe that, but I am one to lean towards believing it.
Absolutely. Because if you're noticing the changes in the mirror, but if the messages in your head are still negative, or if they're only positive because you see the changes, it may be worth it to seek some of that extra support from certain practitioners like therapists, spiritual practitioners, people who can really help you develop those new mindsets and new beliefs that support sustainable long-term results, even after you've been taking it for a while or once you get off.
And in fact, I'll share, as a pediatric nurse, we had some teenagers and young adults, I think it was mostly teenagers, that would go through the gastric sleeve procedure. So...
Oh, teenagers?
Yes, teenagers.
I didn't realize they do that procedure so young.
Yes, and we're talking 300 plus pound, very, very overweight. I mean, they are in the category of obese. And when they get to the point of the gastric sleeve and came to our floor, it was actually a very congratulatory approach with the nurses and doctors, because they have to go through a program. They have to sit with therapists. They have to go through a camp, and they have to see, are you qualified and do you have the right mindset to go through this procedure? So that I really appreciated with the children's hospital that I worked at, because I think, honestly, that approach might need to be looked into for the adults considering these medications now, because that should be a factor. If mindset does play a role, we got to look into that and not just give it out to everybody like it's candy on Halloween. October's coming.
Yeah. And it's also interesting because that's a surgical procedure and this is an injection or a pill, right?
Yeah.
But this can still have so many even life-altering side effects, although it's not a surgical procedure. So it's almost, what are they weighing here? Why aren't they doing that? Like you said, it makes so much sense now that we're hearing this mindset component.
I do think one factor is money. I mean, let's be real. That's one. It takes some investment to provide therapists, to provide a camp, and all these things, to provide a program. And number two, unfortunately, adult medicine is even worse than the healthcare that we have for children. I think both those things come into play, unfortunately.
Yeah.
As far as eating disorders go, there is stronger research out there. Overall, there are a range under the umbrella of eating disorders, but it's really advised against taking a GLP-1 in general based on the research that is out there, because it can trigger restrictive behaviors or just an overall relapse of whatever eating disorder you may suffer from. And also the amount of eating disorders that are undiagnosed because of stereotype. Not everyone who has an eating disorder is skinny and bone-like, where you can see their bones. It's not always anorexia. Again, with seeking extra help and support, if that's something that you've considered in yourself before, I wonder if this has been an issue, like making sure that you take care of yourself and what needs to be taken care of first before considering a more invasive option. So always, I feel like the three of us can agree that the least invasive option is the best way to go forward first in most cases.
Yeah.
Definitely depends on your health, but
even that example, the one where the doctor was suggesting a gastric sleeve and she's like, can we go a little less invasive first?
yeah. One last interesting piece is that I kind of touched on earlier with food cravings, but GLP-1s also act on the brain's reward system. So the same pathways that are tied to those cravings, alcohol, nicotine, and even other addictions like gambling, I'm sure even like porn, they all act on the same pathways. It might explain why they can help with a binge eating disorder. So it all ties in there, but I just thought it was so interesting that it's being researched and how it plays into the support and treatment of addictions. So it's not an FDA approved use for it, but it's being researched.
Interesting.
But for now, it's a reminder that while medication can play a part, don't underestimate the value of support, whether that's therapy, coaching, or something else, because that's just important for the whole picture. Your mindset plays a huge role in your long-term success, especially for those who eventually want to taper off and maintain the lifestyle changes they're making while they're on the medicine.
Yeah.
And now for part 2 of this episode. But first, I have a quick trivia question for you ladies.
Ooh, I'm good at these.
I know, you are good at these.
Okay. All right. Let's see about this. I'm kind of betting on Island. You do have good luck with this. What year did GLP-1 medication first become approved by the FDA?
I'm going to let you answer first this time, Island.
Okay. Well, in general, I thought it would go by each medication, perhaps. Maybe I'm wrong. But okay, for sure, I didn't hear much about the medications before COVID, but maybe it was approved around there. I'm almost going to guess. Let's just go with 2019, 2020-ish. We'll go with that.
And I'm going to go with 2016.
Okay.
That's what's jumping out to me.
Okay. 20 years ago.
What?
Oh, so we're both wrong.
2005.
What?
The first medication, the first GLP medication. I forgot the name of it, and I don't even know if it's still commonly prescribed, but the very first one
Whoa.
Dang.
Wouldn't have guessed that.
was approved. Yeah. But still for the same original treatment, like type 2 diabetes, like how it's still most commonly prescribed and approved by insurance. It was diabetes approved for that.
Wow, so it's been out this long. I wonder why it's just like launched up so rapidly more recently. That's interesting. Well, failed that one.
Wait, I technically won though because I'm closer.
Dang
right?
it! If it was The Price is Right, fine. We're going with The Price is Right rules. Then yes, Lauren is the winner.
I'll take it. Just kidding.
Yes. So even after so many years, GLP-1 medications still feel so new to many people. So of course that results in many questions still being asked. And I think some of the most common questions we hear about GLP-1 medications are, how do they work? What do they treat? A big one is, are they safe? Do you need insurance? What foods should you eat while you're taking them? And there's even questions out there about natural alternatives, like are there foods or supplements that act like them or support it? So jumping in, let's just start with the basics of how they work. In simple terms, GLP-1 medications help regulate your appetite, slow down how quickly food leaves your stomach, and it also helps to manage your blood sugar. You'll often hear them called GLPs or GLP-1 agonists. And that word agonist, it just means that the drug binds to a receptor in your body and activates it. So these medications activate and mimic a natural hormone in your small intestine that is called GLP-1. Your small intestine already makes it. And GLP-1 stands for glucagon-like peptide 1. And this is the hormone that plays a really big role in controlling your blood sugar, digestion, and appetite. So, breaking it down even further into 4 steps or 4 different points of how it works. Point 1 is GLP-1 stimulates insulin release. And insulin helps move sugar from your blood into your cells for energy. If your body doesn't make enough, your blood sugar stays high, which can eventually lead to diabetes. And GLP-1 tells your pancreas to release more insulin after meals, which helps lower and control your blood sugar levels. This is important because if you have high blood sugar, it's very damaging for those big sugar molecules to be running around in your bloodstream. It's very damaging to your blood vessels. So, controlling your blood sugar is important to prevent blood vessel damage. Point number 2, it blocks glucagon release. Glucagon is a hormone that raises your blood sugar. GLP-1 prevents unnecessary sugar from being released into the blood in this way by blocking the release of that. Point number 3, it also slows stomach emptying. Food moves more slowly into the small intestine, so you feel fuller for longer, and it also helps you avoid blood sugar spikes in that way as well. And point number 4, it helps reduce cravings. GLP-1 also acts on appetite control centers in the brain, which helps with overeating and food cravings. I thought that was a pretty unique point to this medication. It's not too often you hear about something that can actually help you reduce your cravings, so I thought that was cool. All right, the next big frequently asked question is, what are GLP-1s used for? Originally, they were approved by the FDA for treating type 2 diabetes, but today they're also widely used for weight management and obesity reversal. Some doctors also prescribe them for women who have PCOS because oftentimes they struggle with insulin resistance, which makes it more difficult for them to lose weight. And a lot of times they struggle with being overweight for that reason, which can lead to other issues like obesity, diabetes, heart disease, other chronic conditions. So, research is ongoing into other benefits like lowering heart disease risk and what it can do to help with that, because a lot of the chronic conditions get interwoven there. A lot of people with heart disease also have diabetes and vice versa. Now, for this question, are GLP-1s safe? This is where it gets a little bit tricky, and we've talked a lot about it in the first half of the episode, but the short answer is yes and no. When used responsibly under a doctor's care, they can be safe, and if you abuse them or neglect what your body may be trying to tell you and you're just putting up with a lot of the negative side effects, then no, maybe they're not the safest option for you. They've been researched for about 20 years, but like any medication, there are risks and side effects. And speaking of possible side effects, a lot of people want to know. There are very common side effects like nausea, vomiting, constipation, and diarrhea, abdominal pain, those sorts of things, because of the medication's ability to slow down, and it just changes the speed of your digestion and a few other things. So that's why those are more common. But there are other possible side effects like low blood sugar, especially if you're taking it with other diabetes medications, feeling tired, belching, hair loss, depression or thoughts of suicide, pancreatitis, gallstones, thyroid cancer, allergic reactions, injection site reactions, acute kidney injury, especially if you're dehydrated and not drinking enough water. Also, gastroparesis, bowel obstruction, and changes in vision or blindness. Other reported issues are things like muscle or bone density loss, headaches, and what's called Ozempic face, where You have rapid weight loss changes, and it changes and makes your facial features a little bit more sunken, like your cheeks and eyes. Doctors really should monitor muscle mass and bone density while their patients are on GLP-1s. So if you're on it and your doctor is not monitoring this, advocate for yourself and ask if this is something they can do or if they can refer you to somebody that does. So I think it's worth mentioning it is a medicine, so side effects are part of the story. But on the other hand, for people with severe or unmanaged chronic conditions like diabetes, heart disease, or obesity, in these cases, sometimes the benefits may outweigh the risks, especially if they have already tried everything else under the sun that's not working for them, or if they're trying to avoid a surgery and going with a less invasive option. There are always so many different things to consider when you're going to take a medication, so that's why it's important to talk openly with your doctor, ask questions, and discuss your options so you can advocate for yourself and what's the best route forward for you. I also feel like it's important to mention compounded versions of a medication. This is not something unique to Ozempic or other GLP-1 medications. A medication is compounded when a pharmacist or physician customizes an existing drug into a new form or dosage to meet a patient's specific needs, such as a different strength, a liquid form, say if someone has a difficult time swallowing pills, or if someone's allergic to an ingredient from the commercial product, they can compound it to remove that allergen potentially. While these compounded versions of medications contain FDA-approved ingredients, compounded medications themselves are not FDA-approved, meaning they haven't undergone the same extensive review for safety, effectiveness, and quality as commercially available drugs. Basically, non-FDA approved copies of GLP-1s, and I've read that some use different ingredients like semaglutide salts, which haven't been proven safe for humans. So if you're unsure what you're taking, or if you're having really negative side effects to whichever medication you're taking, always check what you're being prescribed and ask your doctor if you're not sure. There are plenty of people who take compounded versions of the medication and do not have negative side effects, so I don't say this to scare people, but more so just for awareness. When it comes to insurance, your coverage depends on a few things like your diagnosis, the exact medication, your insurance type, and also if you get your insurance from your employer, then your employer may have opted to include add-ons in their insurance for weight loss meds for employees. So as far as your diagnosis, it seems like if you're using it for diabetes, then you are more likely to get insurance coverage than if you're using it only for weight loss. But there are cases where people are getting it approved by their insurance provider for weight loss. So it really is on a case-by-case basis. Without insurance, it's also really common for people to pay out of pocket through weight loss clinics or medical spas, and probably other providers too. Okay, the next question. What foods should you eat while on GLP-1s? I debated talking about this one because I am not a registered dietitian, but I feel like it's within my scope to discuss it from this perspective. Considering that these medications slow your digestion, certain foods can make the side effects worse. Anything that's spicy, fatty, or acidic, those foods are usually common culprits at exacerbating some of the side effects. And also because your appetite is reduced, the quality matters way more than what tastes good or the quantity. You really have to focus on getting enough protein, especially since it helps prevent muscle loss and keeps you fuller for longer. Fiber is also really good at helping you stay fuller for longer, and it has the added bonus of helping with your digestion, especially to help prevent the side effect of constipation. Also, getting plenty of water helps with that too. You still want your diet to pack a punch with nutrition since you're focusing on the quality. So think things like lean proteins, fruits, veggies, whole grains, and high fiber foods. So try to limit things with a lot of added sugars, refined carbs, and processed snacks. Like everything in life, nothing is off limits, but I definitely want to set you up for success in talking about the foods this way. Another thing to consider when it comes to more quote unquote risky substances, alcohol is known to sometimes make side effects worse. In some people, it doesn't affect them much at all, but for a lot of people, it does make side effects worse. So they tend to cut back or avoid it. Other things to be mindful of, like if you decide to partake in activities like cannabis that have the ability to increase your appetite. Well, since your digestion is slowed down, you might run into some issues if you give in to the munchies and things like that. Be mindful about your food if you decide to partake in that. One helpful tip from a survey participant was when eating out, look at the menu ahead of time so that when you are out with your friends, you're not stressed about finding something that won't upset your stomach. And if creating a supportive diet stresses you out, maybe consider working with a registered dietitian who can also help tailor your diet to your needs. Another idea is, signing up for a home meal delivery service like Factor Meals, for example. As far as natural options that act like GLP-1s, it was really difficult to get clear answers on this, but it seems like there are foods and supplements that may support GLP-1 activity naturally, but they're definitely not going to be as strong and potent as the GLP-1 medication itself. Things that you can eat that can help support that activity is high protein foods, fermented foods, high fiber foods, foods rich in omega-3 fatty acids, also foods with polyphenols like berries and green tea. And supplements that I was reading might help are things like berberine, probiotics, and omega-3s. And teas like green tea, yerba mate, and chamomile can also support digestion and appetite regulation, as well as, chamomile is well known to help with sleep, which is also very important to regulate energy and support your weight loss journey. Other things to consider, like if you're experiencing side effects like bone density or hair loss, finding a high quality supplement may be able to help you with that as well. And as we wrap up today, I hope that both parts of this episode gave you some fresh perspectives to consider on your GLP-1 journey. Everything we shared was meant to empower you, support, spark reflection, and encourage conversations with people you trust, including your provider. At the end of the day, nobody knows you better than you. That makes you your own best advocate in deciding what path feels right. And remember, long-term success isn't just about medications. Your lifestyle, your habits, and how you care for yourself will always play the biggest role whether you choose GLP-1s or not. Until next time, keep growing, keep glowing, and always trust your own bestie perspective. Disclaimer, this podcast is for informational and educational purposes only. It is not medical advice. Always consult your healthcare providers before making any health decisions. As licensed registered nurses and certified coaches, it is our passion and within our scope of practice to educate you about your options so that you can feel empowered about the decisions you make for your health. Conversations like these aim to assist you in advocating for your health, inspire conversations between you and your healthcare providers, and we share this conversation from experience and perspective, so it should not be a substitute for your personal doctor and healthcare.